At an extraordinary meeting between various stakeholders in the health sector as well as Doctors Union KMPDU, Ministry of Health CAS Dr. Rashid Aman put the responsibility of recruiting health workers as that of the county governments, pointing out that recruitment on a permanent and pensionable basis is a matter that requires approval from various stakeholders.
The county governments must determine the gaps that they have and identify the resources that would be able to employ doctors to fill those gaps.
In spite of their high-risk occupations, sick and bedridden health workers are unable to meet their capital demands in hospitals with the National Hospital Insurance Fund (NHIF), indicating that strategies are being put in place to mandate responsibility of medical covers to an overall body.
We propose that all healthcare workers in Kenya are covered under comprehensive medical cover provided by NHIF. This can be done either through a centralized cover by national government or through the Ministry of Health, or by various county governments procuring on behalf of its healthcare workers with standardized benefits.
Challenges in the health sector have not spared university lecturers who double as doctors. Submissions made by Kenyatta and Nairobi University leadership on the lecturers were, however, strongly opposed by the Doctors Union, outlining that doctors' plights continue to be mishandled.
These are benefits that are provided by the University Council to all staff members under the same said terms of service for medical members of staff with, I'm underlining, with clinical duties.
The only issue was call allowance, which actually we think that that is an allowance that they don't deserve, because this is supposed to be an allowance that is targeting those people who take emergency calls.
These doctors work day and night on shifts and on call, and they're always available. It's a bit insensitive to the plight of our doctors in this country.
The National Assembly Health Committee has now recommended that Ministry of Health should, in the next 14 days, settle the dust at KEMSA and relay PPEs to all public health institutions. The Ministry of Health is also required to ensure that health insurance is available in all counties within the next 2 weeks. Universities should also clear all pending call allowances within 7 days and submit a report to the committee on the 2nd of December 2020.
MOH should provide enhanced medical insurance cover for medics on contract as they wait to be converted into permanent and pensionable terms.
Majority of the issues have been given a time frame between 7 days and 14 days. Our strike notice lapses on the 6th of December 2020. That is essentially 13 days from now.
The progress on these, among other measures, are expected to be presented come next Wednesday to determine whether doctors will change their position come the 6th of December 2020.
We are hopeful that the actors that are responsible will take action and resolve these matters.
Ben Kerera, K24, Evening Edition.